So everybody, welcome to the Parent Resource Center. This is our workshop on school refusal. I would like to introduce you to Dr. Lisa Bateman.
All right, thank you all so much for coming today. Before we get started, just so I can know my audience a little bit, could I get a show of hands if you're comfortable, if you're here because you're a parent? And then a show of hands if you're here because you're an educator or working with the school system. All right, great. So we're actually kind of about a 50-50 split, and I think we can tailor the presentation to both of your needs and how we can really work together on the family side of things and then on the school side of things. So Valerie did a great introduction. I don't have to bore you with any more details about myself. I will just tell you at the bottom how to find me or other people who do similar work to what I do. I do have business cards today, but as far as finding a provider, there are a couple resources that I usually recommend to people. Two places that I often recommend to look. One is a website called Psychology Today. So you can find me on there, but you can find all kinds of psychologists in the area. The reason I like Psychology Today is that it's really comprehensive and you can search by a variety of different terms. So for one, you can search by your insurance and things like that are logistically helpful, but you can also search by things like cognitive behavioral therapy. So if you know this is specifically what I'm looking for, a psychologist who can provide that service, that's a really great place to start. And then the other place where I'm listed that you can find me, that you can also find other providers who do a lot of work with school refusal and anxiety, is something called IOCDF. It's the International OCD Foundation, and it says OCD, so sometimes people think it's just OCD. The reason it's a helpful resource is that in order to get on the IOCDF Foundation website as a provider, you have to have experience in providing cognitive behavioral therapy and exposure and response prevention, which I'll talk a little bit more about later. So they do a really good job of kind of making sure that those are the treatment approaches that are provided. Those treatment approaches are what's evidence-based for anxiety. So just a little note in case you're ever looking for me or someone else. And then just to kind of set the stage, so thinking about school refusal and what it looks like. For parents out there, this scenario might feel kind of familiar. So it's first thing in the morning, you're rushing, getting ready to go for work. You're trying to get breakfast done, backpacks packed, out the door on time for the bus. The bus is coming. And Johnny says, my stomach hurts, and he wants to stay home. So you say, okay, well, you know, he's never done this before. He's complaining of a tummy ache. He looks like he doesn't feel well. We're going to stay home. And then you stay home and you notice as the day goes by that Johnny's playing, he's running around, he seems to be perfectly fine. And you kind of think, that's interesting. He really seemed like he didn't feel well this morning. Now, as the day goes on, he seems a little bit better. And then the next day, it happens again. So you remind him that it happened yesterday, that he felt better as the day went on. You know, well, let's try to push through. Let's just go to school. You go to work. He goes to school. You get a call from the office. Johnny went to the nurse. He feels sick. He wants to come home. You go pick him up. You bring him home. Same kind of pattern emerges. You start to see that as the time goes by, the longer that he's home from school, he seems to be feeling more like himself. The next day, he reports the same symptoms and refuses to go to school. And you're flustered. I mean, as a parent, this is where these types of things are really frustrating and exhausting. You're trying to get out the door. You're trying to do all the things you need to do. You're also trying to understand that there's something going on with your child, and you're wondering, you know, what would you do? And this, just for the sake of time, we'll just kind of think about that scenario to set the stage as we move forward. So the question of how do we define school refusal? So it's not exactly a DSM diagnosis. You know, you won't find it listed like the way you would find depression or generalized anxiety disorder, partly because it's a relatively newly recognized phenomenon, but really because it's rooted in other anxiety disorders. But essentially, school refusal is when a child has trouble either going to school on a consistent basis or remaining at school. And it can look different depending on the child. So it could be, you know, complete absenteeism from school. It could be going to school in the morning but leaving early. It could be delaying school, so refusing to get out of bed, refusing to get going in the morning so that the child is chronically late. It could be staying at school, but regularly leaving the classroom with complaints of not feeling well and going to the nurse. And then in some cases, it's just a battle of going to school. So the child does attend, but this is where, parents reflect on the part that other people might not see, that every morning getting there really is a battle. The child often pleads or bargains to stay home from school. So it is surprisingly more frequent than we would expect. People don't talk about school refusal all that much, or at least didn't until recent years. But what we know now is that school refusal affects about 2 to 5% of school-age children. And the reason that, and we'll talk a little bit more about school refusal versus other types of absenteeism, the reason that children are not attending school when we're talking about school refusal is because of anxiety. It tends to be a somewhat gradual process, so it starts with, some absenteeism and then gradually becomes increasingly intense over time. And then this is just kind of an interesting fact at the end, that it has found to be more frequent in children who have average to above average intelligence. This is true of anxiety in general. There are some theories around this. One is that the child who is bright, well, that's a very positive quality. Their brain is kind of constantly working, constantly making connections, and it finds it easier to kind of jump to these conclusions that we might see with anxiety. So that's just an interesting note that, sometimes people think of school refusal as a child who's not attending school because of difficulty with school, but that may not necessarily be the case. In many cases, children are very academically bright and very quick to pick up on the academics of school, but still are saying that they don't want to go to school. So things to look for when we're talking about school refusal, and I broke them down into different types of symptoms. So the behavioral symptoms that we would be seeing would be anxiety and panic. And anxiety in children can look quite a bit different than anxiety in adults. So we know as an adult what it feels like to be fearful. Your heart beats rapidly, you have racing thoughts, your hands feel clammy. You can identify it if you've been in a fearful situation. This is what it feels like to be anxious. Children may not have that vocabulary. A lot of times when they feel anxious, they might report physical symptoms rather than actual thoughts. So they might not be saying, I'm worried about going to school because of a test. They might just be saying, my stomach hurts. Anxiety also looks different in children than adults in that sometimes it manifests more as irritability. So when you think of anxiety in adults, you think of that physical discomfort, you think of the racing thoughts. For children, it might more look like acting out. It can look like avoidance, and that's really what school refusal is avoidance of school because of anxiety. Sometimes, and this is in line with that irritability, it looks like defiance, increased tantrums, crying, irritability, difficulty in the mornings, oftentimes this battle between parents and the child. And sometimes it can manifest as self-harm, not all the time, but this is something to look for as well. And then, as I mentioned, a lot of times the first thing you'll hear with school refusal based in anxiety is actually the physical symptoms. So you might not hear the behavioral symptoms starting out. You might hear more about stomach aches, headaches, nausea, dizziness, pain, or difficulty sleeping, particularly on school nights, difficulty falling asleep the night before school, difficulty staying asleep, or oversleeping in the morning. So the other thing that you want to look for is patterns of behavior. So with school refusal, the symptoms, and this is kind of the Johnny example I gave at the beginning, they tend to come on relatively suddenly, but then they tend to kind of peter off, particularly once the avoidance has been accomplished. So you would see these symptoms kind of wax and wane really with the presence of school. So a lot of times when I'm working with an individual with school refusal, we'll actually start out just kind of charting the behavior. So getting a sense of when is it happening. This is particularly helpful for kids who are really expressing more of the physical symptoms and saying, this is a physical problem. It's helping them build that awareness of, oh, do we see a pattern that this is happening Monday through Friday, but these symptoms aren't really there on Saturday and Sunday. That's kind of interesting. So what we would look for is the absence of those symptoms when school is not in session. So weekends, holidays, summer vacation. Symptoms would tend to worsen, usually around Sunday evening as we get closer to the school week, and then they persist throughout the school week. They sometimes disappear completely if the child is allowed to stay home from school. Sometimes they're still there, but a lot of times they would dissipate quite a bit if the child is home from school. Sometimes you hear a lot of visits to see the school nurse and complaints of those physical symptoms at school. And depending on the root of the school refusal and what the anxiety is about, it may happen when the child goes to other places or may not. So for example, if you have a child who's avoiding school because of separation anxiety from mom and dad, you would likely see some of those same symptoms if the child was going to dance class or going to stay at a friend's house. So if that separation was the root of the anxiety, anytime that you're separating from mom and dad, you would see these symptoms occur, not just with school. Now, if there's something specific to the school that's the root of the anxiety, whether it's related to academics or bullying or other things along those lines, you would just see it at school. And you might see a kid who presents totally typically in all other situations. And this is where a lot of times I'll hear from parents, he's totally fine when I drop him off at soccer practice. But then when school rolls around the next morning, it's a battle to get out the door. I always like to talk about this because there's sometimes a lot of confusion around school refusal and truancy. And I hear a lot of frustrated parents coming to me and saying, nobody understands what it feels like to be dealing with this. Even other family members, the grandparents, they say, well, in our day, kids just went to school. Why can't you just take your kid to school? Friends say that too. Oh, why does your kid think it's not allowed? They're not allowed to go to school. He has to go to school. And people, don't always understand, and a lot of times place blame on the parents. And they say, you're not doing your job because your child isn't going to school. And this is what I hear a lot from parents, and it's very frustrating and very discouraging because it is so different from a child who's being truant. And so that's why I wanted to talk about this a little bit, partially because if you are a parent in that situation, I want you to be able to advocate for this idea of, school refusal is really different from truancy. So first I'll start with, typical behavior. So a child who misses school, due to illness, that, a true physical illness, that wouldn't be school refusal. And even a child who occasionally complains about going to school also wouldn't be school refusal. So, if you're thinking of your child, you might think, well, plenty of times they've said, gosh, I don't want to go to school today. But then they get up and go and, it's okay. And that wouldn't be school refusal. That's more kind of typical child or teen behavior. Now, school refusal would be much more intense than that. So it's this absenteeism that's caused by anxiety. And a big differentiating factor between school refusal and truancy is that often the child will say that he or she wants to go to school. And I see this all the time with the kids that I work with. They say, I really do want to go to school. And even sometimes they'll get excited about it on the weekends and they'll say, this week is going to be different. I can do it. I know I can do it. When it's this hypothetical thing that's a little bit in the future, they're saying, I do want to be there. Now, when school rolls around and the anxiety increases, they're not always able to go. And oftentimes there's a lot of shame and embarrassment around that. So there are kids saying, I don't know why I can't do this. I really want to. Everybody's upset with me. I know they're upset with me. I know I have to go to school, but I just can't. And that is a very different picture from a child who is truant. That's a child who's struggling with anxiety, who's struggling with this fear of going to school and the difficulty of overcoming a fear, and a very different feeling than a child who's truant. Now, truancy, we've all probably heard of, and truancy is not rooted in anxiety. Typically, one of the big things that differentiates truancy is that it's planned. So it's a child who's saying that they don't want to go to school, and usually because there's some reason for it. They'd rather go to the mall or wherever kids go and hang out with their friends, and there's a plan involved, and it's usually kind of sneaky. So truancy is usually mom and dad don't find out about it until they get a call from the school and realize, oh, my child didn't show up after they got on the bus today. And that's quite a bit different from school refusal too. School refusal is often a battle between parents and children. It's children who, are they're really digging in their heels. I know I need to go to school, but I just can't. I can't do it. And parents are deeply involved in the process. It's not this kind of underhanded, manipulative truancy where the child is planning and breaking the rules because they're engaging in some other more enjoyable activity. And they may even, a truant child might even brag about it. They might say, to their friends or other people, I didn't go to school today. And that's a lot different too from that child who's experienced anxiety, who I've worked with kids who, in the cases of school refusal, they'll hide when they're walking by the windows if they're home from school because they don't want anybody to see that they didn't make it to school that day. And so that's a very different picture. They're recognizing that this is a behavior that I'm not choosing, but it's something that's really hard for me to do. So common onset periods, school refusal can start at any time. When I see it happen the most, oftentimes transition periods. So this can be for young kids, when they first go to school. Sometimes it's that transition from elementary to middle or middle to high school. I would say that elementary to middle is often a big transition because you're going from one classroom, one teacher, staying with the same 20 so kids all day long to changing classes, 4 different elementary schools feed into one middle school. You've got 4 times as many kids. You've got 7 different classrooms. You've got to change classes within 4 minutes. You've got to learn all these different teachers. You've got to track all their different ways of putting assignments online. And so that's a time when I see it quite a bit for a child who's already prone to anxiety. That's when I might see the school refusal start. Other times that it may start would be after a long break. So actually this last period, this last month or so since winter break has just been a really tough time for kids with school refusal because it's been so disorienting. We had 2 weeks of winter break and then we've had snow days and MLK Day and various things that have popped up and there's no consistency, right? So for a child with school refusal, that's really tough because every time there's one of those holidays that you think is, an exciting, good thing, it's that much harder to then get back into the routine of going to school after that. And then sometimes a child who's missed some school, after an illness might, when they're returning, then experience that school refusal. Sometimes that can be tied to the illness. So I've worked with kids who had some sort of illness, maybe involving vomiting, and then they develop a phobia of what if I vomit at school, and that's why there's some school refusal. Sometimes it's not tied to the illness specifically at all. Sometimes it's just that break from school, missing out on all the schoolwork, knowing they have to catch up on everything they missed, and getting back into that routine of going to school. It can appear at other times though. These are just kind of the most common times that we see school refusal start. So really when we talk about school refusal, in research and in practice, we call it anxiety-based school refusal, but we just kind of drop the anxiety-based because that's pretty wordy. But I say that because really the roots of school refusal are anxiety. And there are all different types of anxiety disorders. I listed the most common ones that affect kids and adolescents here. And each of these anxiety disorders manifests in a slightly different way, but can all lead to school refusal. So social anxiety is a pretty common one connected to school refusal. It's just like it sounds. It's difficulty with social situations. It can look different for different kids. So for some kids, social anxiety might be on a one-on-one connection basis. They might really fear, what if I get into a conversation and I don't know what to say? What if I say something silly? What if I embarrass myself? What if I'm awkward? And those types of situations are really difficult. Sometimes for some kids, social anxiety is just with same-age peers, and they might feel very comfortable talking to younger kids or adults. Sometimes they might be really comfortable talking to their peers, but not comfortable talking to adults. And so going to school and talking to teachers may be really difficult. And then sometimes social anxiety can be more like a situation like this, where a child might be really anxious about public speaking, raising their hand in class, being called on. They might feel really comfortable on one-on-one basis, but when it comes to standing up in front of a group of people, may feel really uncomfortable. School anxiety isn't exactly a DSM term either, but it is a very common phenomenon that we see where children experience anxiety about various parts of school. Sometimes it's related to homework, sometimes it's related to tests and quizzes. I've worked with children who, have no trouble going to school on regular days, but on days when they know they have a test, that's when the avoidance will occur because of the anxiety around performance on a test, maybe for various reasons, maybe because of being able to achieve a certain grade, maybe because of worries about what if I'm the last one to finish. Separation anxiety is often with a caregiver, a parent, difficulty separating from a loved one, and it can be because of the fear of if I separate from them, something bad may happen to me, or it may be something bad may happen to my mom or dad or whoever the caregiver may be. And that's where difficulty attending school can occur because of this fear of, if I'm dropped off for school, what if something bad happens to, let's say, mom while I'm gone? And this can be rooted in a lot of different things. So I've worked with children who experience separation anxiety, maybe following a parent who's had an illness. And so then there's this worry of what if my parent gets sick and something happens when I'm gone? Sometimes it doesn't seem to be triggered by any one thing in particular. It's just that difficulty separating from parents. And as I mentioned before, you would see that in different scenarios too, not just with going to school. OCD is something that probably most people are familiar with to some extent. It's this pattern of obsessions and compulsions that cause distress. A lot of people think of it like it's portrayed in the media, which is that contamination OCD. If I touch something and it has germs on it, I have to wash my hands a lot. And that is one type of OCD that's relatively common, but there are actually a lot of different types of OCD. And OCD, really, the obsessions can be about just about anything. Common ones that we see besides contamination, sometimes obsessions about harm, sometimes obsessions about numbers or things that we would think of as the patterns of behavior, tapping certain things in a certain way. We call that the just right feeling in OCD. So a lot of people with OCD will describe, if I don't do this just this way, even if it doesn't make sense to anybody else, it just doesn't feel right. And then that's why they do the behavior, to get rid of that not right feeling so that it feels better. But then it becomes this kind of vicious cycle of needing to do it more and more. This can relate to school refusal in many ways. So I know Valerie shared that I have a lot of background in OCD. I work with many different types of OCD, and the school refusal related to OCD is very common. So sometimes it's that contamination example of, school, there's a lot of people there, that everybody's touching everything, there's the fear of germs, and that's why a child wouldn't want to go to school. A lot of times there's a perfectionistic component to OCD. So I've worked with kids who are extremely bright, extremely driven, but if their paper doesn't feel just right, they're not going to go to school because they don't want to turn it in. Even if logically they know, if I don't turn this in, I'm going to get a 0. If I turn it in and get a 90, that's better than a 0. But in their head, it's not perfect, and so I can't turn it in. And so that might be a way that you would see school refusal with OCD. I see that quite a bit with people I work with, where if things aren't, all just right, then the child will refuse to go to school. Generalized anxiety disorder is a kind of lump term for all different types of worries. It's basically, a child who experiences a lot of different worries. Sometimes they're worries about safety, sometimes worries about natural disasters. Sometimes this would be where you would see a child who was maybe previously attending school fine, but then learned about something bad happening in schools and then became anxious about going to school because of that, and that worry of, what if that would happen to me? Specific phobias are related to, one certain thing. The distinction between generalized anxiety is that it's a lot of different worries. Specific phobias would be kind of one worry. And a child might be afraid of, one specific thing that they would have to do at school, maybe related to things I've heard, having to do physical exertion in PE, and a worry of something that might happen with that, and then not wanting to go to school on days that they would have PE. And then panic disorder is, a pattern of panic attacks. A lot of times people think of panic attacks as being triggered by a certain event. Interestingly, panic attacks typically start randomly. So the individual will be, a child, for example, could be sitting in school, and if they start to have panic disorder, they've been attending school fine, they're sitting in school one day, all of a sudden their anxiety spikes, and that panic occurs for no particular reason. And that's often what they'll say is, I wasn't thinking about anything in particular, nothing happened, I just felt really, really anxious. What happens then, once an individual has had a panic attack, is that the panic attack becomes the fear. So I worry I'm going to have another panic attack, and it's often associated with where it first occurred. So if I had that first panic attack at school, now I'm worried I don't want to go back to school, because if I go back to school, what if I have a panic attack there? And that's where the agoraphobia comes into play, which is difficulty, leaving your safe place, which is often your house. So when panic disorder escalates, it often leads to agoraphobia, which is staying in that safe place so that you don't go to places where you might be afraid of having a panic attack. So those were all of the anxiety reasons that we might see school refusal. And as I mentioned, it's always tied to anxiety in some shape or form, but there are other triggers and causes of the onset of school refusal as well. So I mentioned those transition periods and the difficulty with transition. Transition is hard for everyone. I say this to parents all the time because we know it's hard for kids, but if we think about transition in our own lives, change is hard, and we can kind of recognize that that is a challenging time. Now, for a child who already has anxiety, transitions are really hard because the child is already coping with anxiety about a variety of different things. Then life changes and they have to cope with anxiety about everything else. Other things that might lead to school refusal could be stressful life events, and I listed a variety of different ones here. So there can be stressful life events that are affecting the family, can still affect attendance at school, and then certainly stressful events that are happening in the school. So that would be things like bullying, difficult peer situations, peer rejection. So sometimes, when we think about bullying oftentimes with males, there's this kind of overt bullying behavior. With females, there's often this type of kind of peer rejection that is equally challenging to deal with. Both of those types of situations can lead to school refusal. And then sometimes academic difficulties. So a child who's had a pattern of difficulty academically may start to refuse to attend school because school becomes a place where they feel stressed all the time. So negative effects of school refusal, not surprisingly, the more school you miss, the more you fall behind and the harder it becomes to catch up. So there are academic challenges associated with school refusal, particularly the longer that it persists. Social challenges, particularly from an avoidance perspective. So when we think about, a child who may be avoiding school because of social anxiety, the challenge of avoiding school is that then they're no longer getting that practice of social anxiety and so social situations, and so those become even more fearful. The more you avoid, the harder that thing actually becomes. And so what we see is that the less opportunities a child has to interact with peers by going to school, often the harder those social situations become over time. And then we'll talk more about, the patterns of anxiety, but essentially any time that you're avoiding a situation, anxiety in that moment of avoidance gets temporarily better, but it actually gets worse over time. So what we see is that the more that school refusal occurs, the more that anxiety grows. And then sometimes the end result of school refusal can lead to dropout or some alternative diploma because of difficulty, once it's been going on for so long, kind of difficulty catching up and going back. And that's what we're hoping to prevent. So what should I do? And this is kind of the bulk of what we'll talk about. What should I do if I think that this could be my child or someone I know, or if I'm an educator and I'm starting to notice this pattern with one of my students? So you do want to start by talking to your child. Sometimes, when we think about kids, we make a mistake of not talking to them about anxiety and feelings and emotions, just because we might think that, they may not understand it or they may not want to talk about it, but that's really where you want to start. And I always say, talk about this at a calm time. So, not right before school when everybody's stress levels are high, you're worried about getting to work, they're worried about getting to school, talk about it on a weekend when tensions are low, everybody's feeling calm, maybe in a nice neutral environment to give that conversation a chance to go well. Listen to your child, ask questions about how they feel when school rolls around, and then one of the big things is, validating what they're saying. So I talked a lot about how in children, anxiety manifests as physical symptoms. Those physical symptoms are real, and we don't want to get in a battle with a child of, well, you're just anxious, because they're saying my tummy hurts, and you're saying, well, you're just anxious. And what that sounds like is that we're not validating their feeling, because their tummy really does hurt. In that moment, they're feeling that physical symptom. We know that they're feeling it because of the anxiety, but they're still feeling it. So we want to validate that. You know, I know that you don't feel well. I understand that you don't feel good. I understand that your stomach hurts, because when you get worried, it makes your stomach hurt. And so validating those feelings and not getting in a battle of, you know, why they're feeling the way they're feeling, or are they really feeling sick, you know, being able to understand, you know, I know you are feeling sick. I think this is why that's happening. And then talking about those physical manifestations. So one of the things that I'll share with kids a lot that sometimes they think is kind of cool is this idea that when kids are developing, you know, before they're born, the cells that go to the brain are the same types of cells that go to the stomach. So actually these cells kind of grow together in utero, and then as the baby starts to develop, some of them go up to the brain, some of them go to the stomach. And I'll kind of explain it that way to a kid where, you know, we're not getting into deep science here, but enough to understand that even from before birth, there's a connection between your brain and your stomach. And there's a lot of research out there to support this, that brain-gut connection, they call it. And that is why we feel so much anxiety physically, particularly in the stomach, because there is this underlying physical reason for it. And sometimes explaining that to kids is helpful for them to understand why they feel the way that they feel, that there's a reason for it, and that it really is their brain kind of playing tricks on them, because it feels like, you know, it feels the same as if they ate something bad or have the stomach bug, but it's really their brain playing a trick on them. And it's because of that connection between the brain, when it's feeling worried, it's sending signals to the stomach to feel that way. And then a lot of times I always recommend just asking open-ended questions to try to get some ideas of why your child feels the way they feel about going to school. So, you know, when Monday morning rolls around, what are you thinking about? You know, when we're trying to get out to the door, well, why does that feel hard? What are some of the things that you're feeling worried about? So the next thing would be to help your child connect the difficulty of attending school to anxiety. So a lot of times I mentioned earlier that, you know, after we have that discussion of how anxiety can manifest physically, we'll start to kind of track the anxiety. And this is particularly helpful if a child is saying, well, you know, I don't think it's anxiety. I'm not worried. My stomach just hurts. And we'll say, okay, well, let's get some data. You know, let's treat it like a science project. Let's get some data and see what it says. And we'll track it for, you know, a week or two, and we'll see, oh, wow, you know, there really is this pattern on, you know, Monday, Tuesday, Wednesday, Thursday, Friday, things are feeling pretty bad. And then Saturday, Sunday, things are feeling a lot better until Sunday night rolls around. You know, that's kind of interesting. And so we'll make that connection between the school attendance and anxiety, and then that brain kind of physical connection as well. And then the big thing is helping your child understand how anxiety works. So I like to use visuals. I think it's helpful for kids to be able to see what it looks like. The first visual in green there is what anxiety looks like when we're avoiding. So you think of any situation you've been anxious about. Let's say a situation like this today, you're anxious about public speaking. And so you think about, you know, going to do a talk, and you're all ready to go, and your anxiety spikes. And so you say, oh, you know, let's cancel, let's not do that. And then you feel better. And so that's that, you know, nice downswing. The problem is the next time you think about doing that same thing again, your anxiety spikes right up, at least as high, if not higher. And so you think about any time you're avoiding a situation, it's that temporary relief, but it's followed by a worsening of anxiety. It's partially because by avoiding, you've kind of validated your anxiety. You've taught your brain that fight or flight response, I should be avoiding this situation. And so that anxiety grows. And then it also gives you that more time to kind of build up that anticipation and anxiety. So for a child who's not attending school, you know, they're saying Sunday night, I'm going to do it, I'm ready. And then Monday morning rolls around, and anxiety spikes and they say, no, I just can't do it, I'll do it again tomorrow. Anxiety goes back down, but then tomorrow rolls around and the anxiety goes right back up. And so I'll describe this to kids as like living your life on a roller coaster. And it's tough, if you've ridden a roller coaster, it's really hard to catch your breath. You're up and you're down and it's all over the place and it's really, really challenging. Now there is an alternative, and that's what treatment for anxiety looks like, and that would be the second graph here. It's the exposure. So I know it's a little hard to see, but the top line is the first time you do an exposure. So a lot of times I'll ask a child to think of a time that they faced a fear, and a lot of times they remember the first time they rode a bike or the first time they put their head underwater in a pool. And we'll think about, okay, how did you feel that first time training wheels were off? Mom or dad was about to let go, and they'll say, I felt really worried and my anxiety went up. And then, what happened as you continued to ride? Well, I felt a little anxious at first, but then it got better. And that's, that first, you wait out the anxiety and it does start to go back down. And you say, okay, well, what about the second time you rode? Was it as bad? Was it as scary? And they say, no, it was a little scary still, but it was a little bit better. So the anxiety doesn't go quite as high, and then it goes back down. And then that's that pattern of the more you do exposures, the lower the anxiety becomes over time. Now that's kind of like an ideal world there, where it says like first exposure, it goes higher, second exposure, it's already better. That's not always the case. Exposure is tough. If you've ever faced a fear, you know that it's tough, and it's not always the first time you do it that it's just magically better. It's sometimes you have to do it a lot of times, and you have to practice repeatedly, and you have to kind of stick with it for it to start to get a little bit better. For older kids, sometimes I will explain kind of the brain component behind this, because sometimes they like to hear about that. So what I explain to them is that your fight or flight response is in something called your sympathetic nervous system. So when you're in an anxious situation, what happens is that sympathetic nervous system gets kicked on. It's like a light switch. So it goes on, your fight or flight response is activated. And now all of a sudden you're in that anxiety stage, and you're either going to do something to fight it, get it away, or you're gonna run. Now, the interesting thing is if you're in an anxiety situation, that sympathetic nervous system is on, but if you wait it out, if you don't fight or flight, so if you don't try to get rid of it, if you don't run away from it, if you just kind of stick with it for a while, you have something called a parasympathetic nervous system, and that's going to kick on after a little bit of time passes. Your parasympathetic nervous system is what calms you back down. So your parasympathetic nervous system is kind of like catching a false alarm. Sympathetic nervous system is like the fire alarm going off. Parasympathetic nervous system is like the recognition that was just a practice, that was just a false alarm, and then the anxiety starts to go back down. And sometimes kids will say, I don't think that's true for me. And I'll say, that's fair, right? Facing a fear is hard, and I understand that feeling. It is true for everybody. Everybody's brain is wired with these things. It's just that a lot of times what happens is we don't give our parasympathetic nervous system a chance to do its job. We kind of cut it off. And that's because we don't like feeling afraid, right? So the sympathetic nervous system kicks on, fight or flight response kicks into gear. We don't like it. We want to do something. We get rid of that bad feeling. Our parasympathetic nervous system never got a chance to do its job of calming us down. And that's where exposure comes into play. We have to wait it out. We have to face the fear. We have to give our brain a chance to recognize, okay, this is a false alarm. I'm going to be okay. And then calm the body back down. All right, so after I kind of explain those types of things and how the brain works, we'll talk a little bit about what to do next. So as I mentioned, after we kind of have a sense that this is school refusal, maybe we've tracked the behavior, we know that it's related to school, it's happening on school days, not on vacations from school, then we decide, okay, we've got to do something about this. So some things that you might do, you could talk with the child's pediatrician. Sometimes this is a helpful place to start if you're seeing some of these things. And then if you're already working with a psychologist or psychiatrist, you might talk with that person, or your pediatrician may refer you to one to kind of rule out anything that we need to think about. And so one way that this is helpful particularly for a kid who's feeling the physical symptoms of anxiety, sometimes they like hearing from the doctor that they're okay physically. So ruling out any underlying medical concerns might help the child connect. This is really the anxiety. So that might be a helpful place to start. We talked with the doctor, there's nothing wrong with you physically. We know that there's nothing that we have to treat on that side of things. We just have to work on how are we going to approach this school refusal. And then another great resource and place to start is working with your school. So I mentioned before, the prevalence rate of school refusal is 2 to 5% of school-age children. So if you think about that, this isn't your school's first go-round. They've been through this before. They've worked with other families on this challenge. So particularly school counselors, school psychologists, maybe the specific teacher as well, likely have some ideas and strategies based on things they've done before. So you can talk with them about their recommendations, potential accommodations for your child, and a plan for what to do next. So as far as treatment for school refusal, the evidence-based treatment is cognitive behavioral therapy with exposure and response prevention, and those are those graphs I demonstrated earlier. The idea of exposure is gradually facing fears. So CBT is kind of a buzzword when it comes to therapy. Really what it means, the cognitive piece of CBT is learning to identify unhelpful thoughts, and learning to recognize that those thoughts may occur in the brain, but that they don't have to be believed. So a lot of times what happens is, the average person has about 50,000 thoughts a day, which is a lot if you think about it. And statistically, some of those are just bound to not be helpful when you think your brain is producing that many thoughts that rapidly. So some of them are not going to be helpful thoughts. Now, when you're not anxious, you're able to just kind of ignore those unhelpful thoughts. Okay, that was a weird thought, and then you move on. When you're anxious, what happens when one of those thoughts occurs is it triggers a reaction. So part of the idea of cognitive behavioral therapy, that C piece, is learning to catch those thoughts, get a little bit of distance from them, so be able to label them, oh, that sounds like an anxious thought. And the clue I always give is if it starts with what if, it's probably an anxious thought. If it's trying to predict the future and it's predicting the worst case scenario, it's probably an anxious thought. Labeling those thoughts helps you be able to kind of separate yourself from the thought and maybe not necessarily believe it, which is a big step in cognitive behavioral therapy, being able to recognize that we don't have to believe every thought that we have and we don't have to act in accordance with every thought that we have. The behavioral piece is that action piece. So it's being able to identify that those thoughts may be there, but I don't have to listen to them. So that thought may be saying, if I go to school, something terrible is going to happen. I don't know that that's true. That sounds like an anxious thought. It's saying, what if I go to school and, something bad happens to dad? Well, that what if tells me it's anxiety, and I don't know that it's true. I don't have to believe it. So what if I do go to school? What if I test it out and see if it really comes true or not? And that's the behavioral piece, and that's where exposure comes into play. This type of therapy, which can be done, we'll talk about how we would just incorporate these strategies even as parents. It has a lot of evidence base for being very effective. And in comparison with things like medication or other, short-term treatments, this has much more long-term effectiveness. So sometimes it takes a little bit of time to kind of get the effectiveness going. It's not as quick as, say, like medication, which could be, working in a couple weeks. And a lot of times, actually, what I'll share with parents is not to be surprised if there's something called an extinction burst. So if you're trying to extinguish a behavior, oftentimes the behavior gets worse before it gets better. If you ever had a whiny 2-year-old, you might remember this from when you were doing planned ignoring for the whining. You don't pay attention to the whining, and the whining really escalates until you keep not paying attention to the whining, and then eventually the whining starts to go down. And that's true with anxiety as well. As we start to push back against the anxiety, it's not unlikely that we'll see that extinction burst where it kind of gets a little bit worse before it starts to get better. But the big thing about it getting better is that it gets better long term. And as far as doing this type of therapy, if we're at a place where it's intense and a child needs to be working with somebody, beyond just the parent and the school, just to make sure that if you're looking for somebody who treats school refusal, look for somebody who says that they do cognitive behavioral therapy with exposure, because that's what's going to be the most effective for treating school refusal. Now, where we would start, and these are things that you can even do with your child, starting now, would be that psychoeducation. So I always start with providing some understanding. If you talk with kids, you know that if you tell them something, they'll say why. So to start with the why is a good thing. This is why this works. This is why we're going to give it a try. This is the science behind it. This is how it works. That's where those graphs come into play. This is how it'll help. And then the first step would be creating an exposure hierarchy. So your exposure hierarchy would be those steps of facing the fear. Starting, we would label it, let's say from 1 to 10, 1 being lowest level of anxiety, 10 being highest. Let's say 1 is, for a child who hasn't been attending school, 1 might be just sitting in the parking lot, not getting out of the car, sitting in the parking lot, knowing kids are walking by, or maybe 1 is just sitting in the parking lot when nobody is there, sitting in the parking lot on a Saturday. And then maybe 10 is actually, fully going to school, going to classes, doing all of those things. And then maybe 5 is somewhere in the middle, like being able to go into the building and go to their favorite class, but not go to other classes. You would fill in the gaps, 1 through 10. And I always tell kids as we start to put these things on there that we're going to make the list, but then we're going to forget about like 7 through 10 for a while, because sometimes if we start thinking about that too much, that causes a lot of anxiety. We're putting it on the list for later, but we're starting at the bottom. We're starting with things that are small challenges. It's in that zone of proximal development for all the educators out there where it's enough of a challenge that we're moving forward, but it's not such a challenge that it's completely overwhelming and the child's going to completely refuse or shut down. So you would identify their specific triggers, and this requires, a partnership with your child of thinking about what are the scenarios. You might throw out some ideas, but they might say, actually that would be pretty easy for me. And then you might come up with some other ideas. Oh yeah, that would be really hard for me. Having to go to maybe the cafeteria, let's say for a child with OCD, maybe that would be a 10, is sitting in the cafeteria, touching the dirty rags that they use to clean the tables, touching tables that other kids have touched, going through the lunch line, not knowing if other kids have touched the utensils as they've walked through, maybe that would be a 10. But for another child, maybe that would be the easy part. Maybe lunch is the part they would start with because that's the part that would be fun. So it has to be tailored to the child. It has to be tailored to what's causing them distress. And then we start small, and that's because we want to build success. So anytime we're thinking about exposure, we want to start with things that are a small challenge and then reinforce that success and do it until it gets easy and then move on to the next thing. And part of that is building up the motivation of I can do this, seeing those accomplishments and then moving on to harder things. People often ask me about medication. There's no medication for school refusal per se. There are medications for anxiety. A lot of times when it comes to anxiety, medication is something that can be useful but doesn't need to be used. So in comparison to other things that you might hear about like ADHD, where medication is oftentimes the first intervention, that's not necessarily the case for anxiety. And I see a lot of kids with anxiety get better with treatment without medication. So if that's something you're not interested in, it's not something that always has to be a part of treatment. Sometimes it can be useful. This may be when the anxiety is so severe that the anxiety is so high that it's hard to participate in the steps of exposure. What medication does is it kind of takes the edge off. So it brings the anxiety down a little bit just so that the child can engage in the exposures and see it start to get better over time. The goal though is that's not something that we want to be dependent on forever, because it works when you're on it, but it's not doing anything to teach the skills long term. And that's the part we always want to make sure that we have in anything that we're addressing. Even if medication is a part of the plan, that we're still working on teaching the skills of how do we face and address our anxiety so that it can get better long term. The most commonly prescribed medications that you'll hear about for anxiety for kids are SSRIs. Things like Zoloft, Prozac are the ones that you've probably heard of the most. And they do have good short-term benefits, but again, not so much of the long-term benefits. And then a lot of times parents understandably want to avoid them because of side effects, whereas when it comes to therapy and other things, it's challenging, but there often are not those side effects. So Strategies for parents. One of the big things is, the ideal, if we lived in an ideal world, would be to catch school refusal as soon as it happens. That's not always that easy. The longer a child is out of school, the harder it does become to go back to school. Not impossible by any means, and I've seen kids who have been out of school for very long periods of time be able to return to school, but it does get harder the more school that is missed, because every time school is missed, that anxiety is being reinforced, and so then it's growing a little bit. So ideally, when we start to see school refusal emerge, this is where we want to act quickly. So as a parent, when you're starting to see this behavior, you would want to start the conversation, or as a teacher or an educator, if you're kind of noticing this pattern of behavior, you would want to bring that to the table ideally as quickly as possible. So a lot of times parents ask me, what do I do in terms of parenting for anxiety? So my child has anxiety. I don't want to punish them for having anxiety. It's something that they can't help. How do I parent them with anxiety? How do I keep using all the good parenting techniques that I have, but then I also don't want them to be punished for something that they're really struggling with? And that's a really understandable question, because it's a tough line there. And the biggest goal would be to focus more on positives and less on negatives. Now, it's okay to create expectations for school attendance. And this is one of the things with parenting a child with anxiety. It is still okay to have limits. It's great to have a balance of that warmth and love and empathy and understanding for what they're experiencing, but it is still okay to have limits and say, even though I understand that this is hard, I'm still expecting that this is something that we're going to work on. So an example would be, let's say you created that hierarchy. Let's say a 1 on the hierarchy for a child who's been missing school for a long time is sitting in the parking lot. And they have to sit in the parking lot for, let's say, because exposure takes a little while to work, like we talked about, they have to sit in the parking lot for an hour a day at school. They don't have to get out of the car. That's a 1. It's a challenge enough for them, but it's not so challenging that they, will refuse to do it. You create a contingency. So first we're going to go sit in the parking lot, and then you can have your phone or whatever the currency may be. And that's going to depend on your child. What's the most meaningful to them? Is it electronics? Is it participation in extracurricular activities? Is it time with friends? Is it special, quality time with mom or dad? Whatever it may be, kind of tying this expectation of first we're going to do the hard thing, and then we're going to do the fun thing. Another big thing is to maintain structure if your child doesn't attend school. And this is where, sometimes what happens with school refusal is it's rooted in anxiety, it starts in anxiety, but then staying home gets accidentally kind of reinforcing. Because for one, it's reinforcing because you're escaping the anxiety, but also home is a lot more comfortable than school. And this is where we want to make sure that there's still some structure at home. This is really tough for working parents and sometimes requires, for some cases, but when I've worked with people, I've signed FMLA papers for parents so that they can be home to do this. Sometimes we've had to, outsource other helpers to work on this. But the idea is that, when the child doesn't go to school, it isn't stay in PJs all day, lounge around on the couch and hang out. It's we still get up, we still, make our bed if that's part of our chores. We get dressed, we wear what we would wear to school. We sit at the dining room table that isn't all that comfortable, and we do our homework. And we take a break for lunch, and then we do our homework. And so that idea is we're trying not to make staying home be at all rewarding, because it's already kind of rewarding. It's an escape from the anxiety, but we also don't want it to be rewarding in any other way. So we want staying home to be as structured and as much like the school day as we can possibly make it. The other thing would be, that gradual reintegration plan. This is really helpful where working with the schools is going to be kind of the best way of doing this. After you've created that hierarchy, working with the school of how can we set that plan up. So maybe part of the plan is getting the child back in the building. So maybe there's somebody we can partner with at the school who can allow the child to sit in their office for an hour a day and do some work in there where they don't have to be, if they're not, to the point in their exposure plan where they're out and about with peers, maybe there's a school counselor or someone who can let them sit in the office. So they're doing their exposure, they're there, they're in the building, which is a good step forward, even if they're not quite at the place where they're in class. And that's where a lot of collaboration with the school can be helpful. And schools that I've worked with are great at doing this. I mean, particularly Fairfax County schools are very proactive and very good at, setting up these types of plans and very willing to work with kids to get them back in school, because that's their ultimate goal too. Just like parents, educators want kids to be in school too. Using a lot of positive reinforcement is really helpful. I mentioned this because of what I said earlier, that idea that the child who is avoiding school because of anxiety oftentimes doesn't want to be avoiding school because of anxiety. So that's where, we want to understand that this is already a challenge for them, and we want to really provide that positive reinforcement. Sometimes there's this feeling of, if we're working on our exposure hierarchy and we're doing things that the child's already supposed to be doing, should we really be rewarding them for that? And that's where you want to remember they may be doing things that they're supposed to be doing, but they're also facing a fear. And that's where you want to think about it's okay to temporarily reward facing that fear, reinforce that hard work that the child is doing. Not that the expectation is to do that forever. The expectation is to do that until it gets easier, and then to gradually fade back out that reinforcement. Sometimes there may be a specific stressor that you can find a solution to. So in some cases, I've worked with kids where there's a particular peer challenge that's leading them not to attend school, and depending on the school and the child and the nature of the problem, sometimes I've worked with families where the school has, separated the children into different classes, if that's relevant and helpful in that case. And so sometimes it's that nature of figuring out what is causing the problem and how can I enlist the school's help in coming up with solutions for that particular problem. Sometimes, like I mentioned, so for example, kids I work with OCD who might have some contamination challenges, it may be that going to the cafeteria right now is just too much, and that's why they're not going to school, because that part of the day is so challenging and we want them to go to school. So it may be that, we allow them to go sit somewhere else, go to the library during lunch, or do some sort of alternative accommodation so that they can get in the building and have the access to the education, even if it means accommodating some of those other things. It is helpful to still encourage participation in extracurricular activities. Sometimes I have parents ask, if they don't go to school, should I have them not go to soccer? Which sort of makes sense. If you're not well enough to go to school, are you well enough to go to soccer? Then again, oftentimes soccer is a really good pro-social activity, and not specifically soccer, but all of these things that children participate in outside of school that provide structure and peer support and positive social interactions, those are still really positive experiences. And so oftentimes, still maintaining access to those things even during school refusal is a good thing, and can even be kind of a motivator too, particularly for after school activities. Even if, let's say, the hierarchy is that we're up to attending a half day of school, can we work with the school that if the child attends half of the day, that they still get to go to baseball practice afterwards, even if, they weren't there for the whole day, because that's a good thing that's getting them in the door and they want to be there for that, and we can work up to them being there full time. Sometimes a support system helps at school. So I've worked with kids where enlisting a friend can be really helpful. So sometimes if that separating from mom and dad is really tough in the morning, sometimes having a friend walk over and have breakfast together and then walk to the bus stop together is a helpful supporter. And it kind of gives the child something else to be thinking about and something to distract them from the anxiety. So sometimes that peer support can be useful. Sometimes creating something that the child wants to be involved in is really helpful. So I've worked with children who liked having a specific reason to be at school. So children who, I had one child who was paired with a special education student, and they would meet with that student and walk with them to class in the morning. And even though going to school was hard for that child, the idea of being there and working with someone else and being there for that person was really motivating. And so they liked that peer partnership. They liked having a role at school that they could play. That's just one example, but looking for these different kinds of systems that are available within the school already, and can we build those in to help going to school be more motivating for that child. A lot of times what happens with school refusal is there's a lot of talk about all the reasons we don't want to go to school, and that's natural. That's part of the problem, but we do want to emphasize what are the good things about going to school and definitely try to build on those. As educators, you probably hear all the time that there should be 5 positives for every 1 negative, which is really hard to do if you think about. And that's kind of true in this case too. You know, every time we're talking about the challenges of going to school, we should be thinking about some of the positive things about going to. I have people ask me a lot about fear-based approaches. Now, if you think about a child who's already anxious, fear is probably not the answer. So I've had people ask me, well, if my child isn't attending school, you know, should I threaten to have a truancy officer come to the door? Well, if your child is pretty anxious, I would say no. You know, that's probably going to make it worse. Adding fear to fear is probably not going to be helpful, especially for a child who, again, is saying that they do understand that they have to go to school and want to go to school, but they're anxious about going to school. So I'm always hesitant, you know, if we're not talking about truancy, if we're not talking about deliberately, you know, breaking the rules and engaging in a maladaptive behavior, we're talking about a child who's having difficulty attending school because of anxiety. I really recommend steering clear of those fear-based approaches. Now, you can still have structure and you can still say, you know, you have to go to school to have access to your video game or something along those lines. You know, that's just setting up a contingency, and we all live our lives with contingencies. You know, as adults we have to do certain things before we're able to do the things that we want to do. So it's okay to have that structure, but you know, when people ask me about, well, should I take them to the alternative school and show them what it's like so they know that their school is so much better, I say, you know, I don't think that that's probably the answer for a child who's already afraid. As far as some parenting tips, I mean, you've probably all heard about authoritative parenting as sort of the gold standard type of parenting approach. It's just that balance of being nurturing while still having structure. And as I mentioned before, that's still the approach that you want to have for a child with anxiety. Sometimes the temptation with anxiety is to kind of err more on the side of being a little bit permissive, and it makes sense. I mean, that's where I think for all those parents who have been struggling with this, you know, hopefully you have people in your lives who are being compassionate about this and how hard it is, and the fact that nobody likes seeing their child suffer. I mean, that is why we see some of that tendency towards accommodating anxiety, is it's tough to see someone be anxious, especially someone you love and care about, and so the natural tendency is to try to help them. And sometimes helping them means letting them escape from the anxiety. The challenge of that is that it's helping them short term, but not so much long term. And so that's where we want to kind of balance that. How do I be supportive and encouraging and validating in the moment, but also maintain that structure of, you know, let's have a long-term mindset of how we can work towards going back to school. This concept of parental psychological flexibility is just this idea of kind of sort of like what your child is doing with anxiety, being able to label the anxiety and separate themselves from it and kind of not act in accordance with it. And that it comes into play as parents, particularly when school refusal becomes really exhausting. Sometimes what happens is parents feel frustrated, understandably, every morning is a battle, and that parental psychological flexibility is able to kind of label it as, you know, this is the anxiety is the problem. I'm taking a step back from that, and I'm able to kind of separate that from my child. And we often call that externalizing the anxiety. So with kids, I'll sometimes have them give their anxiety a name. Little kids will call it like the worry monster. Older kids will maybe think of it like a bully that they really don't like. But this concept of externalizing the anxiety is separating it from the individual and being able to kind of label it as the anxiety, but also understand that the anxiety is the root of the problem. And that's helpful when there's a lot of conflict between parents and kids around going to school, because what starts to happen is it feels like there's really a big strain on the relationship. And if we can separate the anxiety and even have that dialogue between parent and child of, you know, this is the anxiety talking, we can kind of put the frustration on the anxiety versus on one another. because that's a lot of times what happens in those battling moments is, the parent feels frustrated with the child feels frustrated with the parent. At the root of everything, really everybody's frustrated with the anxiety. And if we can talk about it that way, it helps parents and children remember, we're on the same team facing this anxiety, which can be helpful with that relationship. Now, I always tell anybody that I'm working with that facing anxiety looks kind of like this. It's this roundabout path. We wish it looked like this. Like in everything in life, we wish it looked like this. But oftentimes it doesn't. It looks like there are curves and bumps and unexpected things along the way. And sometimes it feels like it's getting better just to feel really discouraged. And sometimes after some of the worst days are some of the biggest growths. And so I just try to remind people of that as we're working on things, it's not going to look like that perfect linear line that we see in a controlled environment. It's real life, and it's going to look a little bit all over the place, and we want to focus more on the overall trend and less on every individual day. And that's really helpful on the bad days, because what happens on the bad days is everybody feels discouraged. Gosh, I thought it was getting better. Now what's the point? And the idea is to be able to say, okay, today is a bad day, and sometimes bad days are going to happen, but we just got to stay the course and keep on moving forward so that we don't give up on those tough times. And then during the good times, I always still remind people to still be facing the anxiety. It's once you kind of get over some of the roundaboutness and you're making good trends, a lot of times with the anxiety, especially if this has been a long time coming, there's this feeling of like, a sigh of relief. Let's just stop talking about it for a little bit. Let's take a break from the exposure practice. Like, things are going well and I just don't want to rock the boat. But the challenge of that is that, it really is what we call an exposure lifestyle, where we want to keep up with it on a daily basis and keep monitoring, even on the bad days, keep on pushing and keep maintaining that same focus so that we don't kind of lose what we're working on. We've talked a lot about, avoidance and avoidance prevention. And this is true of any time we see anxiety, is just this idea of how do we set things up so that we are facing anxiety versus avoiding it. And so how do we, have this mindset of what are we going to do to make going to school or whatever our next step is on the hierarchy successful tomorrow? And even if it's challenging, how are we still going to get there? So if the goal for tomorrow is getting to school for maybe we're at a 4 on the exposure hierarchy and it's going just to one class, Bobby's favorite class. And how are we going to make that happen? And even if we wake up in the morning and things are challenging and Bobby's not feeling so good, how are we going to stay the course? How are we going to kind of think about one step forward? A lot of times, things that I'll do for avoidance prevention are trying to break it down into more manageable chunks, because sometimes if you think about things that are really big and challenging, they feel overwhelming and the tendency is to shut down. But if you can break it down just a little bit, that can be helpful. Parents probably do this all the time with homework. When it's getting overwhelming, let's just start small and then we'll go from there. This can be helpful with the exposures too. Okay, I know it's hard, but why don't we at least try to go for 5 minutes? And we'll set a timer. We'll do it together. Let's set a timer and see if we can stick it out for 5 minutes. 5 minutes is up. Okay, we did it. Great. Do you think we could do it for 5 more? And we kind of break it down into these more manageable chunks where it feels like, okay, I can keep persisting with the plan even though it's hard. And a lot of times what happens is the longer you persist, the easier it gets. Modeling those relaxation skills. So relaxation skills are helpful in the moment, but they're most helpful if you practice them on a regular basis. Because if you've ever tried to do something when you're under a lot of pressure that you haven't done not under a lot of pressure, you know it's really hard. And so I try to build relaxation skills into daily life when I'm working with kids with anxiety and practice them when they're not anxious. So a lot of times I'll say practice at bedtime because you're trying to wind down and go to sleep anyway. So it's a perfect time to practice deep breathing or progressive muscle relaxation. You just practice it on a daily basis when you're not feeling anxious, sort of like practicing your basketball. The more you practice, the better you get at it. And then when you're in a game, you're ready. And that's the idea of these relaxation skills. The more you practice, then when you are feeling anxious, the more likely you're able to tap into some of these skills in the moment. So reinforcing your child for that daily practice. And then one of the other things I always talk about is something called reassurance. So reassurance becomes another type of kind of feeding into anxiety at times. So reassurance can look like a lot of different things. For a child who's worried about going to school, let's say because of natural disasters or a school shooting, reassurance might be, a child getting ready to go to the bus and saying, "I'm going to be okay, right?" And mom says, "Yeah, you're going to be okay." And you're going to be okay, right? "Yeah, I'm going to be okay." And "I'm going to be okay, right?" "Yeah, you're going to be okay." And what happens with reassurance is it becomes sort of habitual and almost a little bit addictive in nature. Like once you get a little bit of reassurance, it makes you feel better, but it only makes you feel better for a little bit. And so then you need a little bit more reassurance. So another example of ways that I see this, kids who might be anxious about going to school, if they're feeling those physical symptoms, sometimes what happens is they feel anxious of what if I then get sick at school. And they still go to school, but they do so with a lot of reassurance. And what's happening with that reassurance is it's kind of keeping the anxiety around. So once the child is attending school consistently and we've kind of accomplished the hierarchy, then we want to kind of fade out that reassurance too. Because what'll happen with reassurance is it sort of validates the anxiety just enough that that anxiety is going to stick around. And so once we're kind of high up on that hierarchy and going to school, then we say, okay, so let's try to go to school tomorrow. You're only going to ask me 2 times about if I'm going to be okay, instead of 5 or whatever it may be. And if you can do that all week this week, Friday we're going to celebrate, we're going to go get some ice cream. And then okay, you did it. Next week you're only going to ask me 1 time. And then the week after that, we're not going to say anything at all. And this is tough because sometimes what happens is the child will still ask, and that's where as a parent you can say things like, that sounds like reassurance. I don't think I should answer that question. And you can explain it to them why you're not answering, because it might feel like, well, why aren't you helping me? But you can say, reassurance is kind of like a Band-Aid. It covers up the worry, but it doesn't do anything to make it go away. So instead of that Band-Aid, what we're going to try to do is make that worry go away. And so when I hear you asking a question that's reassurance, I'm going to say that kind of sounds like reassurance, and I don't want to just cover up the worry. I want it to go away. So you can explain it that way so it doesn't feel like you're being, callous and not helping your child, but you're helping them understand that by not giving into the reassurance in that moment, you're not feeding the anxiety long term. Now, one of the things I always emphasize to parents is that school refusal and really any type of anxiety, it's tough. I mean, this is a tough thing to work on because you've got a child who's facing a significant fear. And as I said, a lot of people really don't understand it. And I hear a lot from families that, we've had so many people say, why can't you just get your child to school? And they don't know how hard it is. And so I say this because, it is hard and you're not alone in that. And it's not your fault that this is happening. And it's really important for parents to still take care of themselves and know that, this is something that affects the whole family, not just the child, and that having those coping skills as parents too, and being able to reduce your own stress levels and seek out helpful emotional support is still really important. And then the big thing that I mentioned before is that a lot of times people will come to me with feelings of embarrassment of, I feel like I'm a failure because I can't get my child to go to school. And that's where, understanding that this is a problem that affects a lot of other families too can be helpful. Understanding that schools are, in my experience, are largely very supportive and helpful, and they want children to be at school. Sometimes parents have had interactions where they feel like they're being blamed, and that's where, I think having those supports in place and having people on the school side, liaisons and other people who can help them, advocate for themselves is really great. And then with that graph that I described of the treatment and being kind of a windy road to success, just remembering patience and persistence. It will get better. It does take time. It takes way longer than anybody wants it to, as most things in life, but it will get better. So I always recommend being really open with the school. Like I said, I've had great experiences working with schools on this issue. Now, that's not a guarantee that it's always going to be that way. But what I've found is that schools are familiar with this issue, counselors are familiar with the issue, teachers are familiar with the issue, and they're often really willing to work with families. And often what that'll look like is setting up a 504 plan for accommodations, or sometimes other types of, maybe an IEP depending on the nature of the concern, or other less structured accommodations to help the child reintegrate back to school. So things that I've seen schools do, like check-in, check-out systems. Every time they come to school, they go to the school counselor and they get, a sticker towards, once they get 20 stickers, they get to, order pizza for lunch or whatever it may be. So some sort of positive reinforcement system for school attendance. Those peer supports we talked about. For a child who's anxious, sometimes even just being able to have one of those fast passes where they can kind of flash it, go to a safe place and take a break and then return to class when they're feeling better can be helpful as they're reintegrating to school. And then other accommodations that may be relevant. We always want to make sure any accommodation is tailored to the individual child. So there are all different types of accommodations out there. It doesn't mean that each one is going to be relevant. It's, on a case-by-case basis. And then, just like we talked about with that reassurance, what we want schools to understand when it comes to anxiety is that accommodations are great short term, but we want to make sure we're not accommodating the anxiety itself. So we want to make sure we're still working on that plan of moving forward, even if we have some of these supports in place short term, but the plan is to gradually phase those out. The other thing I get a lot of questions about is hospital homebound. If you're not familiar with this, it's instruction that's provided in the home environment. So I think originally designed for children who were receiving treatment for medical concerns and couldn't attend school, but didn't want to be able to not have access to the academic focus. They have teachers that are sent to the home to work with them so that they're still being caught up. Now, people ask me, should we consider hospital homebound if my child isn't attending school? And what I say is that generally that makes it worse. If you think about it, it's exactly what we don't want to do in that it's accommodating the anxiety. And what typically happens is that if you do hospital homebound for a short time period, then returning to school becomes even harder. So I generally recommend not to do this, for anxiety-based school refusal. Now, it's a totally different case if we're talking about a medical concern where the child can't attend school. The one case where I've seen hospital homebound be really helpful is if I have a child who maybe hasn't been attending school for a long period of time, has missed a lot of academic instruction, but they're engaging in, let's say, some sort of intensive outpatient program to work on school refusal. Then having that hospital homebound component to catch them up on the academic piece while they're addressing their anxiety may be relevant, as long as the plan is returning to school. But as a solution for school-based or anxiety-based school refusal, typically avoiding school makes it worse. And so this is really, a last resort, really coupled with treatment if the child's unable to attend school because of participating in intensive treatment. So I have some resources listed that are in your handouts. There are websites where you can find information about anxiety and about school refusal. But then wanted to leave some time for questions. And I know we were budgeted till about 11:30, but can stay until 12. So if you need to leave, you're more than welcome to. If you want to stay with questions, that's great. And then I'll just repeat your questions just so that they can hear them on the camera. Yeah.
So way back in the beginning, we were talking about causes of school refusal, and you talked about stressful life events.
Mm-hmm.
And one that I did not notice there that we are personally experiencing is transgender. Do you see that as being also a cause? I mean, we have some of the other stuff going on as well. A parent dying, witnessing the illness, knowing that this child himself may have that, inherited that illness, all of that. Now he's transgender as well. So I didn't know if being transgender, even on its own, is a source of anxiety.
That's a great question. So the question is if being transgender can be a source of anxiety, and I know coupled with a lot of other stressful life events as well. So, the research on this is relatively limited, but what we do know is that any kind of challenge that the child may face due to, peer interactions, and this could be, so for example, a child who identifies as transgender may be more likely to be victimized at school and stigmatized by other children, and so that can cause a lot of anxiety around attending school. It can cause anxiety as well even before the child expresses those feelings of being transgender, because the child may express that I don't feel like I fit in this school environment, I'm not sure where I fit, or the fear of, what if I do share these things and I experience that peer rejection. So it certainly is a very stressful experience, for children who identify as LGBT or as transgender. They are faced with a lot of additional stressors that, can certainly impact that comfort level with going to school. So that is a great example. Yeah, I'm sorry that you're dealing with that. I know that sounds like a very challenging situation. And
as hard as it might be for me, I can't just think of my grandson.
Yeah, I mean, it takes a lot of courage for a child to be able to express, how they're feeling in a system that, depending on, the certain people they're around, may or may not be supportive. That's a very courageous step to be able to share that, not knowing how, the school or peers will react. And there are supports, available increasingly. That is one positive, is that there are more supports now available for youth who identify as transgender, and hopefully, those are some things that might be helpful.
Yes, I was wondering, you talked about how the CBT and the ERP are the gold standards. If your child has the school-based refusal and the anxiety that is linked with autism, they always stress ABA, ABA, ABA. So just curious, is the CBT still the gold standard if it's anxiety, even with autism?
That's a great question. So the question was, is the CBT treatment still the gold standard if we have a child who's not going to school who is on the autism spectrum? And so that is a really good question. There's a fair amount of overlap in many ways between treatment approaches of CBT and ABA. Now with autism, there's also a high comorbidity between being diagnosed with autism and having anxiety. So in those cases, if there's an anxiety component, we still want to be addressing the anxiety, but oftentimes ABA looks relatively familiar, and ABA is applied behavioral analysis, and it is kind of the gold standard treatment for autism. And what ABA looks like is really kind of structured interventions and systems of supports where, for example, you set a specific goal, and every time the child practices the goal, they have access to this reinforcement to reinforce the appropriate behavior. And that really is kind of consistent with what we see with exposure. It's just that the exposure is addressing the fear of it. And so if you have a child who's fearful, you would likely be kind of blending the two. So that ABA structure approach for a child with autism, that's really helpful. But then you would also be addressing the anxiety as well.
Dr. Bateman, thank you so much. I just want to, in respect for all your time, I just want to cover two things real quick. Number one, please remember to complete your evaluation of the workshop. Okay, you can either do a QR code on by scanning it, or use the website. Number two, as you leave, if you have time, we have resources pulled for you in the library, and we can always find things that are specific to your situation as well, such as, a child who's transgender, or, co-presents with autism or something like that, so we can get that for you as well, okay? Thank you.
I think I'm not sure. Oh, go ahead. Okay. I don't know if it's the same. I was saying, how do you address the child who has a school refusal, who also wants like electronics like iPad or computer, usually like as a gift, and especially her birthday's coming up too. How do you approach that when she's not even actually going to school?
Mm-hmm.
But she wants this, and it could be good for school. How do you address that, especially when you have another child who is going to school, doing everything, and seeing that you're actually giving the child who's not going to school this reward?
Mm-hmm. Yeah, that's a great question. The question is how to balance a child who's not attending school and then also asking for things, as children do, asking for electronics or things along those lines. How do we address and balance those things, particularly also with consideration of siblings who may be seeing their sibling not attending school and feeling like it's unfair that their sibling is getting the same privileges that they are without attending school, which is a great question and probably something those with multiple children have experienced, is that concept of what do we do if it's not fair. So a lot of times, when we think about the things that children want, we could, depending on the situation, use those as positive reinforcement. So let's say, the child is saying, I really want an iPhone. And an iPhone is a big thing. So it might not be like you earn an iPhone tomorrow. But it might be something like, okay, let's set a realistic goal. So our realistic goal might be, let's say that exposure hierarchy, that this week, every day we go to school for at least one class. And if at the end of this week we've gone every day for one class, then we get 5 check marks, 1 per day. And then next week, if we go for 2 classes, we get a check mark every day we go for 2 classes. And we can set it up either, it's just we keep counting check marks until we get to 500, and maybe that's worth an iPhone. It depends on what you would decide. Or it could be something like if you are able to go 4 out of 5 days of the week to school, then you get a point, and you kind of tally them up that way. Now, I will say that for systems like that, where the reinforcement is going to be pretty far removed, like we said, it takes a while to earn an iPhone, that doesn't always work as well for really young kids. So really young kids might need that immediate reinforcement a little bit sooner. So particularly if we're thinking of kids who are like having difficulty with that transition to kindergarten, they might need a daily reinforcer to reinforce the behavior, because having that long-term extended reinforcement doesn't feel as meaningful and they might not be able to maintain it. Whereas an older child could say, and they could have that kind of responsibility of being able to plan ahead and say, yes, I can wait for that delayed gratification of the reinforcement, even if it means I don't get it for 3 months. So thinking about the age of the child is going to be really important for making that plan, but trying to think of it as, particularly a reinforcer. Now, the challenge of siblings is, I was already going to school and I didn't get an iPhone. Why does she get an iPhone? Because now she's going to school. So there are different ways that we can approach that. Sometimes it is, understanding for the sibling something that's going to be meaningful to them too. So sometimes when you've been dealing with anxiety and the difficulty of parenting a child with anxiety, even quality time with a sibling could be really meaningful, because sometimes what happens is siblings feel like, gosh, mom and dad, all of their attention is, on Bobby because Bobby's having so much trouble going to school. So it may be that there are other ways to balance that out. The other thing that you can explain to the sibling is that it's not that we're reinforcing Jill for going to school, we're reinforcing Jill for facing her anxiety. And there might be times when you feel anxious too, and you do something that's really hard, and we're going to reinforce you for that too, because you're taking on a big challenge. And so it's separating really what you're reinforcing is the facing the anxiety, not so much the action. And that might help the sibling understand, that it's, and feel like it's not so unfair that they're going to school without, reinforcement. Yeah.
I just wanted, as I have a child with autism and OCD and anxiety disorder, and actually have been through the whole school refusal and agoraphobia and everything. So one thing I do want the other parent to understand, and other parents with autism, is that it can take a lot longer for this process with students with autism, a lot longer, and so you have to be very patient. And also, just because within the autism world I'm very involved in that, ABA is becoming more and more controversial. So I think also you need to think about who your ABA practitioner is and make sure that person is really an expert and really, because a lot of places you'll have like a 20-year-old right out of school who doesn't have a lot of experience, and so especially with low support, high functioning kids, high IQ, autism kids, you just want to be careful about who you're seeing.
Yeah, that was a great point. I'm going to repeat it just for the camera, that she was mentioning that for children with autism to really have a lot of patience because the process may take a lot longer. And then to also, for that evidence-based approach of ABA that's long been talked about, to know that there are some questions about it and to really make sure you're researching the provider and making sure that they're experienced in working with children with autism. Yeah, that's a great point. Yeah.
Thank you very much for teaching us all this. I have two questions. I have a daughter that she's 12, and many times I'm called by the school, and I have been called because she has a stomachache or because she injured her fingers playing ball, and so this is like something that happened, and it's less at this time, but I really would like to help her on this part. But I'm called from the school. She goes to the nurse, and I'm called by that. So sometimes I have to stop working and go and get her, or sometimes she will say, "I know you're working." She can go on the bus, and she will check her fingers, things like that. That's one question towards my daughter. The second is I have a roommate that I think the description of OCD. She has a son that he's almost 11. When the snow falls, my daughter says, "Oh, let's go and play in the snow." And she's like, "No, there are so many germs." She doesn't want to let her kid go and play in the snow. "Mom, I want to go and play with my friends." "No, there is mud. You're going to get germs." So mom she gave him bath, even though when she goes and do his business in the bathroom, she's there. So she's over, I don't know what is that, but I don't know if I can do something, tell her something, because I think that is the OCD you were describing about the germs that she's putting on her kid, limiting him to enjoy playing with other friends, and it's a lot of limitations there. Thank you.
Yeah, so the first question was, what do we do if we're receiving calls from the nurse with complaints of physical symptoms that the child is experiencing at school on a regular basis? So this would be a good time, I think, to start by talking with the nurse and maybe expressing some of your concerns, because the nurse may just be hearing the physical symptoms, may not know the history, may not know the anxiety, and so the response that he or she would have was, let's call mom and dad and let them know what's going on. And what might be helpful for the nurse would be, I'm seeing this pattern of this happening a lot, and I'm seeing that it seems to get better after I pick my child up, and so I'm thinking that it's maybe anxiety. Could you encourage my child to maybe wait it out for 30 minutes and before you call me and see if they can go back? And it may be too that they call you and you say, I've heard parents, whether or not you feel comfortable fibbing to your child, I've heard parents say, I really can't get there for 30 more minutes. I've got a meeting at work. And maybe they don't really have a meeting, but they're saying, I've got this meeting I just can't miss. You're going to have to wait it out 30 minutes and then I'll come get you. And then what happens is they get a call from the nurse and they've waited it out long enough and they say, oh, actually your child went back to class. They're okay. So sometimes, you can set up this system of, can we wait it out a little bit and see if it gets better? And sometimes depending on, and this is going to depend on, how busy the nurse's station is and whether or not they can keep your child in the office for that time until they go back to class, but working with them to say, can we wait it out a little bit longer before I come pick them up? Because if I pick her up and take her home, then I'm just reinforcing that behavior and I really want her to stay at school. So maybe gradually kind of waiting it out. And then the other question that I think it was relevant on a broader scale is, what do I do, or how do I be supportive to a friend who might be a parent who might be accommodating some, anxious behaviors? And in this case, it's maybe a parent who's protecting a child from germs, and that could lead to some kind of anxiety around germs. And that would be where I think, approaching it with a lot of validation and support of your friend, of I see that this is really challenging, and I imagine it must be really hard when you see your child worrying. I wonder if this may be helpful, or even sharing from your own perspective of, there was a time when my child was feeling anxious about this, and we came up with this plan of how we could address it. They were anxious about sleeping in their own bedroom, and we gradually, moved them farther and farther away from my bedroom and into their own bedroom. And and it took time and it was hard, and some nights we lost some sleep, but we got through it together. And so kind of like expressing that you understand that it's challenging, but that you also, want to provide that support for how do we encourage the anxiety. And then as far as if you think that another person has anxiety, that's where it's kind of the nature of your relationship, whether or not it's something that you feel comfortable bringing up, and if you feel like it's helpful to the other person. It can be really hard for someone to be approached and, I noticed this and I feel like you might have OCD, even if you're doing it from a place of love and support. So maybe thinking about, how would we approach this, and would it be, in the nature of our relationship, would it be appropriate to approach this, and if so, how could we do so in a way that they might feel, more willing to open up? And I would say more like starting with, I noticed that you feel really worried about your child, and I know a lot of parents feel worried, and I feel worried about my child, and I know you must feel worried about what happens if your child gets sick. What does that feel like? And then if they do share information, you might say, well, I think there might be some people who could help with that. But I think that's one of those things that depends a lot on just the nature of your relationship. Yeah, I think so.
Yeah, so I'm wondering, what do you do if the school environment, if the school folks are not amenable to this at all? In fact, they sort of keep saying things that that really make things a lot worse.
Mm-hmm.
So, that's just been the struggle for over 10 years now. So I just don't know how to, if the mindset is that, this kid is doing this on purpose, or, what's your problem, or, all the other kids get to school on time, why can't you, or don't you want to make your parents proud, and I mean, just on and on and on. It's really hard to keep, defending and saying, you need to go there, come on, let's go.
Yeah, so the question is, what if the school environment is not as supportive as we wish it would be, and if people are sharing thoughts that they feel like the child is deliberately not attending school, or they're not believing the anxiety, or they're not validating the struggle, or they're just really focusing more on that hard approach of you need to be here, what do we do? And that is a great question, because not everybody is always going to understand. And I think starting with education, definitely, so providing articles and resources about school refusal can be helpful. I know, Valerie talked about being a parent liaison, and there are people in the county who are available to be there for assistance, and so it may be reaching out to, a parent advocate and someone else who's a third party who can be there and voicing the same concerns that the parent has. In some cases, and I'm not saying by any means that this is the answer, but in some cases I have seen parents decide, maybe this isn't the right school for my child and make that switch, but that's a really big decision, and it's not always the right decision, and sometimes it comes at a huge financial cost, and so sometimes it's not a possible decision. So ideally, we have a way to make it work, and I think education is huge, so being able to present the information, present the research, present the approaches that are helpful for school refusal, and then reach out to someone who can be helpful, who can, they'd still be echoing what you're saying, which I know is frustrating when you feel like you've already been saying it. But sometimes, for whatever reason, having that person who's involved in the school system, the voice comes across louder. But I know that is a tough situation, because it's not always the case that people understand. And sometimes it's easier to place blame on someone else, by either blame on the child or blame on the parent, even though that's not the helpful solution. Yeah.
Would you treat the anxiety related to the school refusal the same if it was stemming from another condition, for example, pandas?
Yes, that's a great question. So she asked if we would treat the anxiety the same way if it's stemming from another condition, such as PANDAS. And PANDAS is pediatric autoimmune neurological disorders associated with strep. They've shortened it sometimes now, and they just call it PANS, because they've found that it's not just strep, it's other things too. But PANDAS or PANS is a certain type of onset of anxiety that's a little bit different than your typical onset that would be kind of gradual in nature. What happens with PANS or PANDAS is that a child has some sort of illness. It used to be that we thought it was strep, and now it's maybe other things as well. And that illness causes some inflammation in the brain and a reaction that doesn't occur in all children. And what happens is it can lead to the sudden onset of very severe, sometimes behavioral problems, oftentimes very severe OCD, sometimes very severe feeding challenges, eating challenges. And so it looks a little bit different in presentation in that it comes on, parents will express, I had a totally typically functioning child, and then now all of a sudden, out of the blue, after they got sick, now we have these horrible symptoms of OCD that feel like they came out of nowhere. And what happens too with PANDAS and PANS is that even if it's treated, it can flare up again anytime the child gets sick. So if the child gets strep again, or if they get some other sort of illness, the symptoms can get worse again. So the question was if we treat it the same way. From the therapeutic side of things, we do. So the medical interventions for PANDAS are different. So you wouldn't treat PANDAS with SSRIs or things like those types of psychotropic medications. You would treat it with antibiotics and sometimes IVIG treatments, depending on the child. But then for the therapy side of things, we do really treat it the same way. The big thing, sort of like you mentioned with autism, is that we want to have a lot more patience, because oftentimes it does take longer treating a child who has, OCD with a PANDAS onset versus OCD with a non-PANDAS onset. So it can take a lot longer. It can be a little bit more challenging. And sometimes we have to stabilize the health first. So we have to stabilize the health of the child and kind of some of the underlying physical concerns. For example, if they haven't been eating or things along those lines, we have to stabilize those first before we address the anxiety and the OCD and provide therapy for that. But actually what we know is that the exposure therapy for PANDAS onset anxiety is just as effective as non-PANDAS onset anxiety. It's just oftentimes a little bit harder to do, unfortunately, because the behavior is a lot more intense. And so that's where it can take a little bit longer. And it's tough for parents because they're also kind of in that challenging place of, this came out of nowhere versus, I saw this gradually growing over time and I've learned how to adapt to it. This is something that it just happened out of the blue.
And I'm sorry, just to follow up on that. And would you, if the parent was treating it medically but not getting therapy, would it be okay for the school to work with the parent to set up that hierarchy that you talked about?
Absolutely. Okay. Yes. It would still be great to approach, addressing the anxiety and that gradual reintegration to school. Absolutely, even without, that therapeutic component. The therapeutic component would be helpful if necessary, but if you can work and collaborate with the school, that would be great. Mm-hmm. Yeah.
I appreciate all your information. It's been great. A lot of the examples that you provided are for kids who are not going to school. What do you do with a teenager who's been fighting more and more as the year goes? I'm too exhausted, I can't get going, but is still going. How do I approach her with the exposure therapy and work with her?
That's a great question. So the question is, what do we do with a child who is going to school but is increasingly upset about going to school? So the more that the school year goes on, the more the child is complaining or arguing about going to school, but they are still going. So a few things with that. Sometimes, having some sort of system of reinforcement can be relevant there, and it could be reinforcement for, the child is already going to school, so the reinforcement would be getting up, getting ready for school, and going to school without complaining. And if we can do that, then, we get a check mark, and then, we get 5 check marks, and we do X, Y, and Z, whatever is relevant. So it could be a system of reinforcement for extinguishing the unhelpful behavior of the complaining. Sometimes it works to set limits on that. So, sometimes we all want to express how we're feeling, and sometimes we all have days where we wake up and say, gosh, I don't really feel like getting out of bed today. And we might say that to whoever's around, but, we still get up and do it. So it may be that you set a limit on it and you say, I noticed that you're complaining a lot about school, and I understand that it's hard and you're tired. But I also know that, the more that we vocalize our negative thoughts and feelings, the more we feel them and the more we think about them. So I think the complaining is actually not really helping all that much. What if we had put like a limit on our venting? So we get a 5-minute vent session, and you can vent all you want during that 5 minutes, but once 5 minutes is up and you could actually use a timer, then we don't talk about it anymore. Then we have to find other things to talk about until you go to school. And so it's sort of that differential reinforcement of we'll pay attention to these other positive things and build up the positive. We'll put a limit, you know, she's still able to express her feelings, but not ruminate so much on it. And you can explain that concept of, you know, ruminating actually feeds the uncomfortable thoughts. And that's why we're putting a limit on it. And also, you know, for the sake of just the challenge every morning and starting off the day on a better foot.
Follow up on that. What do you do if she's not verbalizing or complaining, but you know what's going on in her thoughts? And it is getting worse because she just, like you said, she ruminates on that. How do you get a child to stop doing things you don't hear?
So the question is, what if you don't hear these things coming out? What if you know that it's what she's thinking or what the child is thinking, and you know that they're feeling bad, but they're not necessarily expressing it? And that's a great question, because a lot of anxiety and depression and other concerns are internal, and we don't always see them. So we can, you know, set up a system of kind of talking about it, and sometimes even like, you know, that idea of setting limits can be helpful here too, of let's express how we're feeling so that we get it out instead of holding it all inside. So that can be helpful. I had a little bit of background, you know, back in my graduate training in something called positive psychology, which I thought was a really interesting movement, where they talked about how we spend all of this time talking about what's wrong in psychology, but we don't really focus on how do we thrive. And so the idea of positive psychology is how do we build on the thriving? And that might be a thing to think about with her too. You know, I've had kids do gratitude journals where they wake up in the morning and they think of a couple positive things, and it sounds kind of hokey, especially sometimes to teenagers, but there's actually some research out there and scientifically proven to show that it does increase happiness over time. And so encouraging, you know, some of that positive too might be good, or thinking of things that she might like to do to start the day off, or things that she might be looking forward to might be helpful too. Yeah.
Someone stated earlier that they got lots of calls from school or the clinic that their child felt sick and wanted to go home, and you were suggesting that, you know, maybe they could prolong that. We've done that, and we've had the child go to the counselor, which is me, and and we've done some breathing exercises and some other things to get the child's mind off of going home. But then the parent may say that it is more difficult to get the child to school the next day because then they know the parent did not come the last time. What do you do?
That's a great question. So the question is, if we aren't picking them up from school because we don't want to reinforce the going home behavior, what happens then if the child is refusing to go to school more because they know I'm not going to be able to escape later? And that is a great question, because it's that balancing act of, you know, how do we address this? And so there are a couple different things that we could do for that. I mean, certainly I think the setting up goals and setting up some sort of system of reinforcement would be helpful. I think also thinking about, you know, maybe gradually setting smaller goals for how long the child stays. So maybe you feel like you still need to, you know, come home early if you go to school, but maybe you could at least stay until this class. And then maybe, you know, for a week you could stay until this class. And then maybe for another week you could stay until the next class. And we could gradually prolong it so they get comfortable with going, but then also gradually staying longer. So that might be a way to kind of meet in the middle on the two. So it doesn't feel like you're, you know, on one side of the school's doing their part to help, but then the parents feeling like, well, what do I do in the morning? Which is, you know, kind of that challenging balance. So if you can meet somewhere in the middle, maybe that would be helpful for the time being, of course, with that long-term goal of staying all day. So that could be one thing. The other thing could be, you know, trying to make the staying a little bit more enjoyable for some way. And not that this is a long-term solution either, but if the child stays, maybe they get to, you know, go help out with their favorite teacher as they file papers or something like that, so that the staying and the being at school is a little bit more reinforcing than the being at home. So that differential reinforcement, again, might help them feel better about staying. It sounds like you've been working hard on this, though, and doing a lot of good steps on the school end.
Having a student be a helper, especially to some younger students. And I don't know, you know, my mind just been thinking,
Oh, I'm glad. Thank you. Yeah.
What do you do when anxiety leads to self-injurious behavior? How do you address that?
That's a great question. So what do you do when anxiety leads to self-injurious behavior? So with self-harm, a lot of times that behavior is rooted in some sort of anxiety or depression. Oftentimes a child will express that they're self-harming because they feel so much internally, and that's a way of expressing it externally. And it's obviously a very concerning behavior for a school or for a parent to see. And it is, you know, I'll differentiate. Self-harm is different from suicidal ideation, and sometimes people worry, if I see self-harming, does that mean my child might do something to take their own life? And that's not always the case. So you would want to do, you know, an assessment to see how the child is feeling and make sure proper safety plans are in place, but it's not always, you know, that the two go together. Now, if a child is self-harming, generally the plan is to have some sort of safety plan where they don't have access to the tools to self-harm either at home or at school. Sometimes if there's been a history of self-harm and hiding it, there might be a system temporarily of rebuilding trust where the parent is doing some checking to make sure the self-harm isn't occurring, and then the more that the child is, you know, reporting and being honest about it, the more that checking can be faded out. The other thing would be to come up with coping skills for anxiety that aren't self-harm. So essentially that's what self-harm becomes. It's a maladaptive coping skill. It's, I feel anxious, I don't know what else to do, so I self-harm. And that's where giving the child other things to do instead. So giving the child access, if it's happening at school, to go talk with the counselor, to go to, sometimes they have these kind of break rooms where there are manipulatives and things they can do with their hands, because as long as they're, you know, using things, then they can't be self-harming at the same time. Sometimes being able to express how they're feeling is a more positive coping skill, sometimes deep breathing and relaxation. But the idea is to kind of label self-harm as, you know, that's a maladaptive coping skill. We want to extinguish that one, but we want to build up all these other positive coping skills instead, so you do have something you feel that you can do instead of the self-harm, and then, you know, making sure that you're monitoring for safety at the same time too. Yeah, that's a great question. Mm-hmm.
How similar or different will the supports and strategies be for school refusal caused by like stressful situations, like marital problems or financial concerns?
That's a great question. So how similar would the strategies be for school refusal that's maybe not connected to an anxiety disorder, but a stressful life situation? And it would be relatively similar. What I've seen with that is that oftentimes the difference may be if a child's coping with a lot of stressors at home, having some sort of positive peer mentor at school is a really helpful addition, particularly if it's maybe a parental separation, you know, having a positive, whether it's an older peer or whether it's an adult that the child can form a bond with at school can be really helpful in those times. Having other pro-social activities to engage with at school can also be really helpful. If there's a lot of stress at home, even sometimes building up some of the participation in after-school things and things that make school and all of the parts of school kind of like a refuge and a good place to go when you're feeling stressed. So building in those social supports. And then the positive thing is that with some of those stressful life circumstances, the return to school and the treatment for it, I've seen is actually a little bit faster acting than it is with the anxiety disorders. So sometimes that would be one differentiation, is it doesn't take as long, which is actually a really good thing. But I think a big thing is building in those positive supports. And then if any of the stress was happening at school, addressing it. So, you know, if any of it is related to bullying or things along those lines, making sure there's a plan for addressing that at school too.
Is there any correlation with the anxiety-based school refusal and oppositional defiance disorder?
That is a great question. So is there any correlation between the anxiety-based school refusal and oppositional defiant disorder, or ODD? which oppositional defiant disorder is sort of what it sounds like. It's this defiance with caregivers or other authority figures that is more severe than, typical temper tantrums. It's more pervasive in nature. So there is a comorbidity between anxiety and ODD, so there may be a higher likelihood if a child has ODD that they have anxiety and vice versa, but they don't always exist together. So that's where sometimes, we want to make sure we don't jump to conclusions, because ODD would be treated more from the standpoint of behavioral reinforcement. So ODD, because it's this, acting out behavior, you would want to have positive reinforcement for the good behaviors and some sort of system of consequences for the negative behaviors if ODD is part of the picture. So it would be a little bit more maybe intense and a little bit more focused on that system of reinforcement and consequences than if we were just talking about anxiety. You might build that component in. Sometimes, I do see the two co-occur, so I'll see a child who's anxious also have some oppositional behaviors. Sometimes it's maybe not always there, but they have been anxious, and so they've gotten used to kind of more allowances for their anxiety, and then maybe they kind of capitalize on that a little bit if they have the ODD, and that's where having those very clear consequences in place would be really helpful. But that's not always the case, and the reason I say that is that we want to make sure that parents and educators and whoever it may be aren't placing the blame on the child, if that's not part of the picture. But if it is, that's where you want to make sure like the home environment is not at all reinforcing. If the child doesn't go to school, they're not sitting at home playing on their phone, their phone is taken away, Wi-Fi is turned off if that's the only way to do it, whatever it may be, that we're making sure that we're not reinforcing the staying home behavior at all. Mm-hmm.
Just wanted to ask, so under this exposure plan, like we have a plan, to just go to one class, just to get back into the school, and even that is hard at times. Mm-hmm. But in this plan, there are other classes that are continuing to be missed over a long period of time, which I understand makes it it would be hard for anyone to go back to a class you've missed for 2 months. Mm-hmm. And so I guess the question is, we've also heard, well, she should be doing the work at home if this is all anxiety, but we've found just an overall avoidance of even dealing with those classes, because even just getting to the one class right now is hard. Mm-hmm. So I'm just curious, in the overall plan, like how do you see getting back to all of the, all of those classes? I mean, we're kind of taking one step at a time, but it becomes harder and harder, it seems like, after you've missed so many of the other classes.
Right, so the question is, how do you balance the academics of the classes that are missed and getting back to the classes that are missed for longer periods of time when you're doing this gradual reintegration plan? And that's a great question, because the plan being gradual means that sometimes it does take some time. And I think you really reflected on accurately the fact that sometimes that exposure of going to one class is so exhausting, of facing that anxiety, that then facing any other anxiety of doing homework for other classes is really hard. And that's where, collaboration with the school, I think, is really useful. So I've worked with some high school students who have missed a lot of class, and we've worked with their teachers as they do, start to get back into the work to figure out what assignments are necessary. Not that, for educators, not that I'm saying that some of your assignments aren't necessary, but what are the high priority assignments? What are the lower priority assignments? What are the assignments the child could do to get the completed grade in the class? What are the ones they could maybe not do and not lose out on, the instruction? And so sometimes there is some plan of how do we minimize the stress of that mounting pressure of work. And sometimes schools are really helpful with that, and teachers can be really understanding and work with the child. Sometimes it can be a system of the child may not be ready to go to class yet, but they might be able to meet with the teacher, during a free period. And of course that requires a lot of time time and energy from the teacher, but sometimes they're able to do that for a short period of time to at least do a little bit of instruction to get the child started. And then with doing the work at home, when that's a battle, a lot of times breaking it down into really small chunks. And so sometimes that might look like, I think now they call it the Pomodoro method or something. It's been around a lot longer before they called it that, but this idea of let's just work on homework for 10 minutes and then we'll take a break for 5, and then let's work for 10 minutes and then we'll take a break for 5, so that you're really breaking the anxiety down into smaller chunks, because the child might see this mountain of work and think like there's just no way, and that's understandable. So that's where the parent could kind of figure out, okay, what's one little thing that we can focus on, let's start with that, and then we'll build up from there. Mm-hmm.
What suggestions, like a solution-focused suggestion, do you have that the school can give parents that, when we do call and say, we're trying to figure out why the student's not coming to school, and the parent, says, I just can't get them out of the house. I can't get them, to come out of the room. So what suggestions can the school give the parent at that point?
That's a great question. So what can the school do to help parents who, when they're talking to parents, parents are saying, I just can't get them out of bed or out of the door in the morning. I just can't get them there. How can the school be helpful? So I think one thing the school can do to be helpful is maybe providing some suggestions of what they've seen work in the past. And schools probably know that better than anybody else because they've been on that end of it in many different times. So they might say, this is what I've seen other parents try. And part of that might be just empowering the parent. There are some things that you can try. And then you might kind of validate that the parent is feeling stressed. I understand that this is really overwhelming. Do you have a sense of, when this started, maybe trying to pinpoint if there was a trigger? Because if you can pinpoint around when it started or when it escalated, you might have some ideas. Even if the child isn't saying it out loud, you might be able to take some guesses as to what might be some of the reasons. You might ask the parent if they see any patterns in behavior that would suggest that this is related to academics or related to tests and quizzes or related to peers, and try to give them some ideas so that they might be able to brainstorm, because they're likely in the throes of the battle and they're just trying to get through the day, understandably. And so if you maybe give them some thoughts and ideas to guide them towards what they might be able to figure out, that might be helpful, because a lot of times being a parent is doing detective work. You don't necessarily have a child who's saying, I'm worried about this because of this, and if you did, it'd be so much easier. But instead you're digging and you're trying to use what you have to get to some of those answers. And then in the meantime, I think just suggesting, this is what we've seen work before, maybe these are some things that you could try, and trying to kind of provide those supports as much as you can. But that's a great question from the school end of things. Yeah.
Thank you so much for staying longer and for everything you've offered today. I'm finding it really reassuring because I am not having any success working with the school to get help on helping my daughter, or at least helping figure out or helping get her in the door in the mornings. She's a 3rd grader. And she, it's a huge battle in the mornings, tears. There have been 3 episodes recently where I end up parking in front of the school because she won't get out of the car. And the school counselor will come out and help me wrestle her out of the car and get her in the building. Then she turns around and runs back to the car. So we've done this repeatedly, so the school counselor's involved. Prior to this, as things escalated, I was doing my detective work, and she struggles with handwriting and math, so I thought, well, maybe there's learning disability, so I asked for a screening meeting. The response in the screening meeting was, and I'd heard this before, she's fine once she gets here. Her day goes beautifully. She has lots of friends. Everyone wants to work with her. She raises her hand. She's doing well. And yet, every morning, I go through this saga, and yet the school keeps telling me she's fine when she's there. And so something is clearly wrong, and I keep trying to get to the bottom of it. But the 2 things, after the wrestling in, the school counselor was like, I don't know what to do. And I suggested, is there some incentive you can provide? Give her a pencil on the day she comes to school on time. And they flat out refused. No, the incentives need to come from home, not from the school. So I get that to a certain extent, but I was like, I'll buy the pencils, like whatever, whatever I can do. And also in the screening meeting, the social worker said, this doesn't sound like anxiety to me. And I said, are you sure you're familiar with all the symptoms of anxiety? Because she may not be exhibiting outward. She may not be sobbing in the classroom or whatever, but certainly there's something going on inside. So I guess it's twofold. One is I'm just complaining because I'm not getting any real concrete help from school. And even this workshop, I found out about from another parent. The school, I mean, as aware as the school counseling staff is of my situation, they didn't even recommend, or like bring my awareness to the workshop. So there's something, so I'm complaining, okay, so there's that piece. But then the other is just, what do I do about this? Like, she's fine at school.
Yeah, that's a great
And
question.
And her grades are good.
Mm-hmm. That's a really good question. I hear that a lot too. You know, what do I do when the school tells me, oh, your child's fine, they're performing great, they're a joy to have in class, they're not the squeaky wheel, you know, they just sit there quietly and they do what they need to do and they know what they're doing and they're doing great. And they don't see the anxiety. So I think sometimes you can explain that anxiety manifests differently in different situations. So you're seeing a very different picture at home, and that this is what it looks like, and this is what anxiety can look like, and also maybe sharing, you know, that idea that we talked about today, that anxiety often looks physical. In kids, it might look more like irritability and tantrums. It doesn't necessarily look like a child who's shaking in their seat. The other thing I would say is that a lot of times we talk about something called anticipatory anxiety, and that's where the thing leading up to, the time leading up to the thing is the worst part. And that's true for a lot of anxiety. So a lot of times you think about anything you're worrying about, and you worry and you worry and you worry and you worry, and then it gets there and it's not so bad. You think about waiting in line for a roller coaster. If you're afraid of roller coasters, the line is the worst part. And then the roller coaster is over in 2 minutes and it was fun. And I think that can be helpful for schools to understand that oftentimes the anticipation is the worst part. And it's those hours before she goes to school and gets in the door and gets busy doing things, that's the worst part. And that's why they're seeing this picture of a child who looks fine. And it doesn't mean that she's not anxious. It just means that it's the anticipation that's really hard for her. And so I think, you know, really reiterating that idea that anxiety looks different in so many different forms, and just because they're not seeing it, you know, doesn't mean that it's not happening. And I had a friend of mine did her dissertation on teachers and school counselors and school psychologists' ability to recognize internalizing disorders, and that's anxiety and depression. And we were school psychologists at the time, so we have nothing against school. She's a school psychologist and works in the schools now, but she was really interested to know how good are school professionals at identifying things like anxiety and depression. And the answer of her study was not very good. And it's not that they're not doing their job, it's that they're called internalizing disorders for a reason. So much of it is internal and you can't see it from the outside. So educators are great at identifying children who have ADHD. They're great at identifying children who are acting out. And it's not that, you know, they're not doing their job, it's that it's really hard to identify the children who are struggling internally because we don't know what they're thinking. And so even sharing some of that research and saying, you know, not in a negative way of you guys can't get this right, but more of, you know, they've really done some studies and shown that these things are hard to notice. And if you don't know what's going on inside the child's mind and their own, you know, anxious world, you might not see it. And then the other thing to share is that a lot of kids put on a really brave front at school. And I see this all the time, and I hear it from parents all the time, of kids, they hold it together really well at school, and then they come home and they fall apart because it is hard to hold it together all day. But they hold it together because they don't want their peers to know what's going on, they don't want to be made fun of for crying in class, they don't want to get in trouble. I mean, a lot of times kids with anxiety are afraid of getting in trouble on top of the other things that they're worried about, so they don't want to do anything that's going to draw attention attention to them. So that's the other thing to share of, they might be really good at holding it together, but somebody can only hold it together for so long, and that holding it together is taking a really big toll. So I think sharing all of those things to kind of validate the fact that the anxiety really is real. And then I think trying to really emphasize that idea of she needs some sort of positive for going to school, even if they're not willing to give something that you provide. Could she go and sit with a teacher she really likes for a little bit if she gets in the door? Could she hang out in the office and do a special task that she feels like she likes for a little bit? Could she go sit with her buddy, if she gets to school in time for lunch? Could she, sit with her best friend in the teacher's classroom instead of going to the cafeteria, or something that feels like a privilege? And maybe brainstorming with the school, would they be willing to do things that aren't physical reinforcers, but things that are still going to be meaningful to her for getting there, because she, it sounds like really would benefit from that positive.
Thank you.
Yeah, I'm sorry to hear that you're struggling with that, and I know that that's tough. So hopefully the complaining helped a little bit. We all need to do that sometimes, yeah.
Good question. I think this is an eye-opener. But we dealt with that problem, and the school didn't help much. In our middle school, the school said it's going to help. They have resources. They have done this. Yet nothing is done. And they send the kid to detention, and things get really worse. What do we do?
So you said they sent them, sorry, I didn't hear the last part, to detention. Okay. That's a great question. So what do we do if the school says that they're going to help, but they're not really helping, it's getting worse, and then they focus on things that are maybe more punishment oriented, like going to detention? That's where I think, ideally, you advocate for your child and hopefully they listen. If they don't listen, you bring a parent advocate with you to say, exactly what we said today, which is that fear-based or punishment-based things for something that a child is already struggling with and that they don't want to have to be dealing with is not the answer. And so being able to say, I understand that, you have these systems in place and you have to have rules, but I want you to understand from my child's standpoint, getting to school is hard, and anything that's going to make it harder is going to lead to less success. So we need to think about things that are going to make it easier, and we need to focus more on positive reinforcement. And I know it's tough as a parent because that's not always heard, and that's where, I think there are, through the school system, there are parent liaisons, and then through even outside resources, there are parent advocates. So hopefully, there's someone you can find within the school system, free of charge, that's already there, and that's their job to go to those meetings with you. Or if not, I've worked with people who have sometimes hired a parent advocate to go to those meetings with them. And then there's this outside person that's able to kind of voice some of those same concerns. And maybe someone who has a little bit, unfortunately, as a parent, you should still have authority over these kinds of situations, but, sometimes having somebody who's in the school system, then they hear that and they take that as more authority. But it's tough because there are times when it feels like an uphill battle, and the schools are, I like to think always having the best intentions in mind, and we like to think, maybe the fact that it's dealing with so many different kids that they just can't help everyone the best way that they should, but ultimately that is their job. And, being able to recognize that they do need to be doing their job, and if it takes, bringing in additional supports, and sometimes, it depends if you're working with a counselor, as a psychologist, I've gone to those meetings with parents and their kids. I've gone to IEP meetings. I've been conferenced in on the phone with meetings with teachers. So if you have any other external supports already in place, bringing those people into it can be helpful. And I know it's tough, and I know it shouldn't have to be that way to bring in those external supports, but that is sometimes what I've seen, make a difference. Yeah. Mm-hmm.
So these last two questions have really formulated for me this thought. Your briefing really should be given to all of the educators, especially classroom teachers, but especially also the social workers, the guidance counselors, the school psychologists, and to whom do I make that suggestion? That some sort of, the teacher training that, because we saw, like you said, about half the room was the educators, and that's great. But a lot of parents feel that they're not getting the support from the school. The school is saying, well, your kid is fine, they're getting B's and C's, what's your problem? It's like, wait a minute. So to whom do I make that sort of suggestion to?
That's a great question. I'm not sure I know the answer to that one. I think, I think you could make the suggestion, you could talk, if you have a relationship already with the school counselor or the school psychologist, you could say, I went to this talk that was informative for parents, but also for educators. Do you ever have meetings where you could bring that in? Back when I used to work in the schools, we did have professional development where we would have speakers come in, and so you could make that suggestion, on your school level and see if that's something that they're open to. And then as a parent, certainly, I know all the parents here did the research themselves and came because they were interested in this topic. And I'm not guaranteeing that they would always agree, but as a parent, you could, if you are going to something like this, say, I found this thing that I think would be really helpful, would you go with me? And I don't know that they would always be able to, but at least saying, I think that this would be really helpful for us, let's work on it as a team, and even kind of doing that on an individual level. And then I can do some research, because I don't know how else, I've worked with the Parent Resource Center, but I don't know as far as getting those kinds of trainings going for educators, but I'm sure that there's a way. So maybe that's something, we can all do some research on together.
I think it just, for you to be dismissed and not validated,
Well, to their credit, it's not as though they don't see that there's a problem, they just don't think there's anything they can do about it, or they don't know what to do.
oh,
It's probably more so they don't know what to do, and probably why so many educators did come today. And in all fairness, I only found out about this because my director is a parent and got the parent resource emails. As a staff member, we did not get them. Yeah, so.
Yeah, so there's definitely some missing pieces
Yeah.
for the district.
I heard about it from the school social workers.
Well, that's good.
Yeah.
That's good, yeah.
The superintendent in the schools, above everybody.
Yeah, to at least disseminate the information to everybody. That's a great idea.
But this was
Yeah.
great, thank you so much.
Well, thank you all for coming. I'm glad you all were here. Thank you for taking the time.